So good day everyone. Today we are going to perform oxygen therapy. So what is oxygen therapy? So oxygen therapy is also known as oxygen or supplemental oxygen administration. It is the delivery of oxygen or supplemental oxygen gas to the person who have low level of oxygen in the blood to breathe. So before we proceed to the oxygen therapy, we need to follow the checklist. So the first thing that we need to do is we need to wash our hands. This is the very important thing to prevent the spread of microorganisms, most especially kay magkunit-kunita sa ato ang patient. So we need to wash our hands. Okay, so make sure na we need nga nag-follow ta sa proper procedure of hand washing. Dili ta dapat malimot og gamit og alcohol to help prevent the spread of microorganisms. Okay? And then the next thing that we need to do is we need to check doctor's order. So dili ta ka-proceed sa any procedure na ato pagabuhaton sa atong pasyente without doctor's order. So makita nato ang doctor's order sa patient's chart. So I have here doctor's order. So kailangan jud nato na ay doctor's order before ta mobuhat og any procedure. Okay. Then next is explain procedure and hazard to the client. Okay? So through oxygen therapy, this helps to extend more oxygen levels needed for the patient. So oxygen poses a fire risk, so you should never smoke or use flammable materials when using oxygen. Okay, so since we need to explain procedure and hazards to the client, but before that one, we need to verify first our patient, or we need to identify first our patient. Kay base niya o batagan nato sa ka-procedure ang tao nga dili day ato ang pasyente or not our patient. Okay, so hi sir, maayong buntag. Unsa ka nito tumanan? Okay, sir, Romnick, ako dahil si Giselle Bulfatuting, and I am your nursing assistant for today. And karon magbuhat ta og oxygen therapy. So, unsa man na siya? So, oxygen therapy is a delivery of oxygen or supplemental oxygen gas to the person who have low level of oxygen in the blood to breathe. Okay? So, okay na ba ni mo, sir, magbuhat og oxygen therapy? Alright. Okay, so siya man ato nga patient, naaman ta sa sakto nga patient. So, mag-proceed na ta sa next step. Okay, so next thing na itong buhaton is we need to assemble all the needed equipments sa oxygen therapy. So, I have here the compressor or the air machine. I also have here the mask, thin plastic tubing. I also have here humidifier line, a cap, and also dili jud ta dapat malimot nga natay water, and of course ang ato nga alcohol. So dili dapat malimot og kuan sa any procedure na atong buhaton, dili ta dapat malimot o gamit og alcohol to prevent the spread of microorganisms. Okay, so na naman atong mga equipments tanan. So mo-proceed na ta sa next step. Next step is we need to check oxygen source setup. So atong i-check ang oxygen source setup. Okay? And then fill humidifier line with distilled water, and then after that one, so ato sa siya nga fill humidifier line sa distilled water. Okay? Tangan na nato siya. Oh, naaman siya line diri, so ato lang ni siya nga i-label. Okay? And then close container. Okay? Then the next step is we need to attach humidifier and flow meter into oxygen source. Okay, so since mao ni siya, anyway everyone, mao ni siya ang ato ang flow meter or oxygen source. So, dili lang nato ni siya ibutang near sa ato nga patient. Okay. Then ato ana ni siya nga i-attach ang ato ang oxygen humidifier and flow meter into oxygen source. Okay? So, the next thing is we need to attach the oxygen tubing. Oh, ato sa siya i-attach diri. Okay. Butang lang nato siya diri sa ato ang oxygen source. And then, attach the oxygen tubing and nasal cannula to the flow meter and turn on to the prescribed flow rate. Okay, turn on. Okay. And then the next step is we need to check for bubbling in the humidifier. So it helps us to determine there is air coming in and oxygen tank functioning. So i-check to nato na siya kasi yung ato mabutang dito is wala siya air nga nigawas. So i-check nato na siya before nato ibutang sa ato ang patient. Okay, we need to make sure that it is 1 to 5 L or minutes. Okay, so okay naman siya. So the next step that we need to do is we need to place patient in a comfortable semi or high Fowler's position. So iput lang sa nato siya diri. Ato nga i-adjust ang ato nga patient sa iyang position karon into a semi Fowler's position. So i-adjust na nato yung bed. Okay. I-adjust lang natin yung bed. And then, we need to place the nasal prongs in the client's nostrils and secure the cannula over the client's ears and or place the mask or tent on the client's face and snuggle it with elastic band. Okay, so, ato na rin siya nga ibuta. So, sir, okay na ka diya, sir?
Okay na siya ko pa naman.
Okay. Okay, so ato na siyang ibutang diri. Okay. Okay, and then the next step is okay naman siya. Nasakto na po na itong tao diri. And then the next step is we need to position oxygen delivery equipment appropriately. So tarungon dapat nato ang ato ang mask o butang dira kay basin niya ug wala na tarong jud so wala po air nga magawas. Okay. Okay na ka, sir?
Okay na siya.
Okay. So okay naman siya. Sakto ra po na itong kuwan diri. So proceed ta sa next step. So the next thing that we need to do is we need to post a no smoking sign on patient's door and in view of the patient visitors. Okay, so oxygen tank causes fire, especially when there is a link in the tank and it is flammable. So dapat mag-amping po ta, dili ta pwede manabako. Sir, dili, please, naano ko ibutang diri nga sign, sir, ha? Para makita nimo or makita sa imo mga patients, imo mga visitors nga bawal dili manabako or do anything nagamit og mga kuryente or nga maka-cause of fire. Okay? So dili na nako ibutang, sir. Okay. Okay, so the next thing that we need to do is we need to check for proper flow rate every 4 hours. Okay, so ato dyan na siyang i-check every 4 hours. And there are tendency that a follow or flow meter might change. Kaya naabiray tendency nga ang ato ang flow meter ma-change. So dapat ato siyang i-check every 4 hours. Okay? Okay na ka diya, sir?
Pero
Okay, so next step that we need to do is we need to assess client nostrils every 8 hours. Okay? So ato siyang i-check every 8 hours to prevent irritation or dryness. Okay, basig na rashes na niya ato ang pasyente diri, so dapat nato siya i-check every 8 hours. Okay na ka, sir? Okay. Then ato lang po siyang tarungon. Basta niya dito, wala siya air. Any go. Okay, so the next thing that we need to do is we need to document the oxygen administration method, the flow rate, and the time the therapy began. Note that the patient's responses to therapy and any change in this condition. So, ato ano siya nga i-document or i-record nato kung sa itong gibuhat sa ato mga pasyente. This is the very important thing. Okay na ka, sir? Wala na ba kayo pamati? Okay. Okay, sir? So, okay na ba yung pagginhawa, sir? Okay. So, okay na siya. But, okay na. So, dili na to biyaan. After ato, dili na to biyaan atong pasyente nga dapat magkuan pud ta, taking good care of the things nga ato ang mga gipambuhat sa atong pasyente. Okay? So, ato na siya ikuan. I-check na lang po nato kay base nagka-rashes na siya. Okay. Okay, and then after that one, dili sa nato i-remove ang iyang face mask or ang iyang mask since naglisod og breath ang ato ang pasyente. And that would be all for today. Again, I am Giselle Bolfatuting, and that would be all about oxygen therapy. Thank you.